So from this research study, can you talk about and speak to some of the research participants as to what priorities they made and how did they make this decision making about the kind of treatment, their survivorship, and what's best for them?
That's a great question, because everyone had an individual experience, but we certainly saw four main themes of how participants made their decisions when they were dealing with cancer and getting their diagnosis and where to go with their treatments. There was definitely one group that would want to be part of the decision making, so they would work alongside their physician or their oncologist, and that was really important. They were part of that sort of process of deciding together, and they liked that, and weighing the consequences. And they also asked a lot of questions, and they were always weighing the risks versus the, all the different options. And that was certainly a key theme there. And then there was another group, and we've heard from some of our participants with their stories already, where they would just put their life in the hands of the caregiver and just say, help me, you decide, you tell me what to do. And it was sort of a passive way of decision making, right? And that might have been because maybe being overwhelmed, I don't know all the reasons, but probably feeling overwhelmed, maybe not having the understanding and the supports, but just saying, I'll do whatever you say. Just tell me what I need to do. So there was that part. And then a third group, even if they did receive some information, had their own way of doing things, and went and did their own information seeking and their own knowledge seeking, and this is where it's interesting, because maybe they wouldn't share what they were doing as well, which is interesting. We had our one participant that shared something about using medical cannabis, for example, and not sure if she should tell the physician or not because of stigma, perhaps. But so there is this other element of making decisions on their own and seeking out information on their own, maybe seeking more holistic, not mainstream stuff that's often offered in an urban area. So there's that part. And then there's sort of this fourth group that would really rely on a lot of their family members or social media, or get some interesting results from somewhere that may or may not have been correct, perhaps, or maybe the safest sort of information. And all of those different four themes, a person could change their mind too, and maybe be more actively involved or hold back as well. So there could have been a time where someone maybe was really relying on a physician, and maybe because of an experience started doing their own homework and being more involved too. So there's that part. It's just interesting to see how everybody comes in with this diagnosis of cancer differently, and how I think healthcare professionals need to be really in tune to what is their angle, so that you can meet them halfway and give them the most information possible that's useful and helpful. And knowing that sometimes if participants aren't trusting you as a healthcare professional, that they will go off and get information somewhere else that may or may not be helpful. So yeah, very interesting how our participants answered so differently, yet you could tell that there was a need for information, and there were moments in time where really they just felt overwhelmed and needed direction too.
I think this is very good insights into how the experiences of participants are and have been, and also during the different times they have it in diagnosis, treatment, in surviving and recovery, and also at the same time, what's the best one they would like to prioritize on based on their own decision making with family members, with maybe looking at resources on internet, with their healthcare providers, and maybe talking to the community people and weighing in on what's best for them at that time. So it's not exactly sometimes like a cancer supportive care model, but what you can think as some things that's best, that works for them and perfect for them at that time and that situation, and with the things that's going on in their life. So thank you very much, Florian, for sharing this perspective. Welcome, Grace Lebosier, and thank you so much for coming to meet us here in this research study, Knowledge Translation Cancer Care Network. And I'm so happy to connect with you in this way to understand your journey in the breast cancer process. So can you introduce yourself to us?
I am Grace Lebosier. I'm a 21-year cancer survivor now. I started with your research project because I'm also a member of a Dragon Boat team, and I am the facilitator for the breast cancer support group. I have been involved with your research since it started, I believe.
Yes. And it's been an awesome journey through this experience of what research has to say. But what would you say has impacted you when you had the cancer diagnosis, the treatment of it in your life?
Because mine was further back, and there wasn't the resources in Kamloops that there are now. I actually had my surgeries in Vancouver, and so amalgamating all of the services became really difficult. I had a surgeon here, I had a plastic surgeon and an oncology surgeon in Vancouver, and my GP was here. So there's no coordination even between our regional health units, between Vancouver Health and Interior Health. So my records were very difficult to pull together. That was one of the things that was difficult. The journey itself, if I had it to do over again, I would try to slow it down because it was so quick that I don't know if I was really aware of what I was agreeing to.
So how did you make your decisions when you had the cancer and the treatment options?
Partly on recommendations from a surgeon. And that was the problem because there was nobody with the medical knowledge that I had within my community that could help me. So I made decisions recommended by my surgeon. I would, with the behind knowledge that I have now, I would do more research before I made those decisions. I'm not saying they were wrong. I'm quite happy with the results, but I think I would research more. There just wasn't enough information out there.
You did mention about your experiences within the Vancouver and then into the Interior Health. So how did you access or use the services or resources available in the community that you're living in?
Well, there weren't any. This is 21 years ago, so there really weren't. My surgery was finished and so was I. There was no references to physiotherapy. You got an exercise sheet from your surgeon and said, do this. I wouldn't have known anything until I accessed other women that had had, in my case, breast cancer. And they were the greatest resource I had.
So what would you say currently is your own recovery and survivorship within cancer and the resources you're receiving as of now today?
They improved, partly because 5 years ago my daughter got breast cancer. And I was young when I got breast cancer. I was only 51. My daughter was only 49. And so suddenly we jump up on the list and testing is available. I honestly believe that testing for BRCA2 genes should be offered to anybody that's under the age of 60 when they get breast cancer. It shouldn't have to be a family to see 3 or 4 people in the family before they do anything. By then, it could be too late for especially for some women, some men, because that gene affects both. That is one of the things that I would advocate for, is anybody under the age of 60 should be tested for genetic mutations.
Thank you, that's well said. And also, right now, what do you envision like to have to promote here in cancer care in your community as resources or even services?
Well, we've been very involved, of course, with your research study, which has brought my own personal awareness up greatly. I believe that because I am a facilitator with the support group, it's brought me in contact with more people. We're over the last 5 years especially, we have expanded a network, and our network has brought in people from the community, both professionals and volunteers. There's just more available than there was. I would still like to see anybody with a cancer diagnosis, and not necessarily breast, but any cancer diagnosis, have a medical professional with them. They need somebody to help them, because unless you are a medical professional and you still miss things, you really don't understand all that that doctor or that oncologist is telling you. You are completely, I would say, blind and deaf.
Yes.
Because it's such a huge thing for people to say, you have cancer. As soon as you say you have cancer, your hearing goes.
Yes, I do wonder who is going to be that person on their journey, because like you said, there's been a lot of advancements since COVID time in healthcare, especially in medical care and in cancer care too. But how do we help and support the journey through, like you said, with the quality of life, and also with helping a person through survivorship and the resources that need to be increased within the community to be accessible and useful in the community?
Absolutely.
Would you like to say anything else about your experiences through this, or a vision for your community?
My wish for my community is that someone like Anne had said previously, a number like 911, you get a diagnosis, whether you're a male or a female, or your child, which is probably the absolute worst thing you could ever hear, and you can pick up a phone and say, I need help. Where do I find this? What do I need? I didn't even know I needed physiotherapy. Physiotherapy or massage therapy can help enormously when you're healing. And so if we had that kind of 911 number, it would help enormously. That is the one thing I did forget to mention, and should, is we need language translators as well, for not just South Asian community, but all communities. We need somebody that can explain it to them.
I get you, yeah. It's all about the cultural appropriateness and the linguistic appropriateness care that people are seeking, the caregivers and family, and helping and supporting them in this journey. That may make a world of difference to the person. So thank you, Grace. It was wonderful listening to you and visualizing your journey and the kind of connections you had in your journey, even the kind of care you require, the stimulation that you need while you're going through, the quality of life and receiving that care, and taking us through that mental pathway of how your life has been and the development one needs to see in the community and in the healthcare service providers who help and support people and caregivers in this journey. So thank you very much.
Thank you. I just
Grace.
want to see this program grow.
So what was the impact that you had because of the breast cancer that you said you had, the diagnosis and the treatment, and how did you get through that?
Oh, okay. So the first part was getting diagnosed. That started with my dentist. He noticed I had white gums and I was bleeding pink. So that led to a doctor visit where we found out that I had tension in my breast. And that went to the ultrasound, which confirmed on September 1st, 2017, that I did indeed have breast cancer. The toughest part was telling my children, and I knew that we were going to have a rough road ahead for a few months. I had no idea it was going to be a rough road for 2 years. But I did make sure that I told them. When I grew up, it was a death sentence. 3 of my friends lost their moms to breast cancer. And so for me, it wasn't a death sentence, but it was scary because mostly I was scared. It was my son's grad year. My daughter was leaving the country on exchange, and I didn't want this to interfere with once-in-a-lifetime opportunities for them. So that was very pressing on me as a mom. And it was really tough to be away from school for a couple of years because I love being with my students and I love the energy that comes from teaching and being in the classroom. So that was tough to be away from. But it came back to me in many wonderful ways, just out of the woodwork. People that I had made a difference with let me know that, so that helped. So there's so much gratitude for the supports that were in place, for having a doctor who listened, a doctor who guided me from the get-go, who told me that I was going to have to be in charge, that the communication between my medical care supervisors was only going to be as good as me making sure they were all kept in the loop. So from radiology to cancer to family practitioners and blood work and everything in between, I had to make sure everybody's name was on these documents so that everybody was informed along the way so they could make better decisions for me. And I was lucky that I was told to have 2 people at all of my appointments so that I had a friend who could drive me and take notes at the appointment. I had another one who'd be looking at my questions to make sure they got answered if I didn't get to them, as well as having, in the wintertime, say when a couple people got sick, I was never without a driver because they were never both sick at the same time. So having supports in place is huge. Having the Rotary House available when I was in Kelowna for radiology, having a place to go where food and accommodation were at a reasonable rate was amazing. Here in town, having the support services of Tracy Waddington, counselor and social worker, are just, you cannot overestimate how much or how important those were. Having access to things, and in Kelowna, one thing that helped that we need to have here in Kamloops as well is someone to take us through and show us the things that are available to us, and then to touch base with us again to make sure later on that once we're more into the routine of the treatments, that we are now actually open to hearing the supports that are available. So the first time through, you get an exposure. Mostly what you register is big pamphlet of paper. When the people touch base with you the second time, that's when you're like, oh, okay, that sounds interesting, that sounds good. What we need to have here, we need to have how to cook, we need to have how to look after each other. We need the support services beyond a couple women once a month. We need to have something available where people can go and chat and be supported, where they are approached. Some people have a big support team. I had a big support team. There are many people facing this alone for various reasons. We have to make sure that no one has to face this alone, because that's where a lot of negative energy goes. If what kept me going was hope. And if you're hopeless, it's a very dark place and very tough to get through. But if you have hope and if you have gratitude and you have resources that you are made aware of, it makes the process so much better.
We do hear that you had a lot of impact on your own cancer journey with the kind of resources you used and also with the kind of impact it has created on your life. So would you tell us like some of the example that you had with how did you access the cancer care services or supports that was in the community?
I'm an avid reader, so I read every poster that was out there because I had a lot of spare time on my hands waiting for appointments. And so that was how I found the resources, from Look Good, Feel Good to Tracy Waddington, having the counseling services, social work services. When I was in Kelowna, I found out about everything from laughter yoga to different exercises available to cooking classes with Inspire Health. And one of the best things I found out about was the Rotary House in Kelowna, where we could stay for $50 a night. That included 3 meals, 2 snacks, and a bed. It was nothing fancy. What was amazing was the camaraderie of people going through treatment beyond breast cancer. And so we could talk about it or not talk about it. But that dining room was full of so much laughter and camaraderie. It was kind of, I guess, humor in the trenches. It was a wonderful place to be. For some reason, people outside of it thought it would be so depressing, but we were all there and we all knew why we were there, so we just were there. Our parking was included. We were less than a block from the hospital treatment room, like from door to door. And so that place, I can't say enough about it. To have something like that here in Kamloops would be amazing. Like if we get a center, we have to have some affordable place for people to stay where a loved one can stay with them as well between treatments. As far as the supports that I've had post-treatment, my Dragon Boat Ladies Spirit Warriors and the exercise group that I had at the not at the hospital, but at TCC I think we're starting it up again just to get in there and get moving, get your flexibility back, get your strength back, be in charge again after a couple of years where you don't feel in control. It's so important to get that control back.
Thank you very much, Anne, for sharing your journey with cancer and also your experiences and the impact and how did you access services. It looks like it's very important for someone on this journey to receive the cancer supportive care and also the cancer navigation and how they can drive their own journey and at the same time receive the quality of care that they need and also improve their own quality of life. So thank you very much for being with us, Annie.
Thank you.
I just wanted to introduce you all to Amy Stark, who is one of our research assistants on this project. And Amy, would you mind telling us a little bit about what your background and also why you're interested in working on this film that we're doing right now, but on the research?
My name's Amy, and I'm an undergraduate research assistant here at Thompson Rivers University. I just recently graduated with my Bachelor's of Science degree in nursing, and working on this project has been something that has opened my eyes to seeing what kind of resources that are in the Kamloops community for those who have not only breast cancer but just cancer, and seeing what resources are available in the community and working alongside the research partners and participants has shown me what kind of change we can bring to the city of Kamloops for those who have cancer.
So I have to ask you, I mean, you've gone through all of this hard work. What are some of the outcomes that we found in this research study, and the impacts, of course?
Yeah. Some of the early outcomes and considerations that we were looking at was to give a voice to people who had breast cancer in the community and what their treatment and diagnosis and outcomes and what their whole journey was looking like. We partnered with the Health Research Cluster Fund, which was a clinical study by Thompson Rivers University, also Interior Health, Thompson Rivers Division of Family Practice, and breast cancer support groups to give women a voice about their cancer diagnosis, treatment, and survivors. So the study identified that there's a greater need to increase access to care with special consideration of ethnic, cultural, and social inclusion of people. It also addressed that there's cancer stigmatization, fear of disclosure, and we need to provide culturally safe and appropriate care for survivorship. It also highlighted there's marginalization, such as distance, social class, race, and gender on how breast cancer survivors experience and their quality of life. A follow-up study was with the Social Sciences and Humanities Research and Internal Research Fund by Thompson Rivers University, BC Cancer, Breast Cancer Support Groups, Kamloops Cancer Connections, and Kamloops Immigrant Society. And it shared insights on how to prioritize recovery and coping and navigation and supporting people throughout their breast cancer journey. Social sciences, humanities, and research groups showed that there was conversations with community stakeholders that needed to bridge the gap between psychosocial, emotional, and mental health needs of breast cancer survivors as well as their caregivers. It was important to recognize that not all breast cancer survivors are the same and that each individual has their own unique needs that need to be met through their survivorship journey. So the Breast Cancer Society of Canada research focuses on the barriers and facilitators of adults with cancer, their caregivers, and the healthcare providers' needs for the continuity, navigation, and survivorship. And our study focused on how we can improve cancer care, support navigation, and survivorship to advance supportive psychosocial care. Our present research focuses on social, gender, cultural issues, and other challenges that people with cancer are facing through their treatment, post-treatment, survivorship, as well as the quality of life after. The breast cancer research study focuses on delivering relevant information about cancer supportive care, as well as implementing state-of-the-art navigation to advocate for access, delivery, and quality of care.
Amy, that's excellent. We have a very complex situation here with a lot of very individual needs and complexities. After doing all of this work and talking to all these participants, what help do you envision is needed to increase the healing and the health promotion and all those complex experiences with breast cancer? How can we do this more effectively?
So our research showed that breast cancer patients may benefit from a variety of different resources and supports in the community. Some of the participants expressed that there was a further need for education and just information about, what side effects could come during their cancer treatment, what side effects could happen in the long term after their treatment is finished as well. They also brought up a need that they wanted more emotional support and access to that. So whether that be in a community setting with peer support groups or different avenues for emotional support, there needed to be more resource and more availability for that. Other participants have also said that there was a need for practical items such as things like housekeeping and transportation and meal preparation and different activities, because when someone's diagnosed with breast cancer, there's a lot of different role changes that occur within the family dynamic. So that's another big concern that participants voiced. Another thing that participants expressed was having more self-management strategies in place. So this can be to deal with and coping with the diagnosis of breast cancer and through their treatment and how to emotionally cope with that and what strategies they can use to ground themselves and still have a good quality of life while going through their breast cancer journey. It also included having more strategies for different side effects that can happen to everyone who has breast cancer treatment. So it can be anything for nausea, vomiting, fatigue, hair loss, anything like that. And lastly, participants also voiced a need for more communication strategies and learning surrounding that and how to voice their concerns and emotions to not only their healthcare providers, but as well to their family members and what support that they need from them during this hard time. So participants also, they voiced a need for having additional education and information provided to them from their healthcare provider and anyone else who they received any sort of treatment from during their breast cancer journey. And this was brought up about any sort of side effects, resources that are in the community, how to access these resources, and how to find good quality resources as well in the community.
So what I'm hearing you saying is everybody has a very individual journey with this cancer survivorship, but we're in a rural community, we're in a rural setting, so we're going to have these extra added layers of complexity, and really we need to be heard, but we also need extra information perhaps too. And that initial kind of meeting with somebody who's sharing your diagnosis, your treatment, whatever, if you have cancer, and giving you all of these different options, you also want to have that information, extra information afterwards. Hearing it firsthand in that moment, you won't remember everything. But also having that just at your fingertips, having it maybe through technology, something in writing, and having that backup person to call if you need, right? Is that kind of what I'm hearing?
Yeah.
Okay. What do you think overall? What do you overall want to say?
Participants with breast cancer can benefit from having a full, comprehensive approach to their well-being and health. So this can include their physical, emotional, psychological, and spiritual well-being. As well, the healthcare providers can work directly with their patients to provide access and available resources for them. And as you mentioned, we are in a rural community, so there are fewer resources than there would be if we were in a suburban center. So having the healthcare providers aware of that and being able to provide the knowledge that they have, that information is very important.
When you were going through all of this research, can you tell me, or maybe even describe the challenges that exist in translating knowledge from research to practice in the context of cancer support care action initiatives?
The ease or difficulty that is experienced by participants can be impacted by different influences in their life. It can be anywhere from geographic location, socioeconomic statuses, and health literacy. Participants who had lived in a rural or remote setting ultimately found that there was less resources for them to access through their cancer journey, and that can negatively impact their health. As well as participants who had limited financial resources found that there was they had trouble with things such as traveling to cities for treatment, staying in different hotels, even managing, what food they're going to eat while they're receiving treatment, as well as paying for the treatment too. That can be a big deterrent for a lot of people. And even follow-up things such as having, care for if they have lymphedema or different side effects that can occur after treatment. So having the cost of those follow-up treatments and care for the cancer survivors can impact their quality of life. And as well, participants who have a lower health literacy have more trouble accessing healthcare. They don't understand the healthcare system, as well as someone who has a higher healthcare literacy. They're going to not be able to access healthcare resources as well. They might not know what questions to ask at their healthcare appointments, and they might go and search for different strategies to help them that might not be effective or safe for them to use. Another barrier was that participants who did not have adequate healthcare insurance found that there could be a delay in treatment while they're waiting to see what they're going to be covered for. It can delay the diagnosis of cancer, which, once they actually start receiving treatment, it can be at a later stage and thus can be harder to treat for them. Finally, participants who do not speak the local language of where they are receiving treatment, they can struggle to access and find resources that are appropriate for them. They might not be able to ask the questions that they're really wanting to ask and know the answers to, and might miss some critical information.
It's definitely more challenging living in a rural place, not having a cancer center, and then you add on this burden of finances, delay in response, going back home perhaps with more questions that you didn't have time to get answered, especially when you have limited moments of meetings with people. I just can't imagine it. So these challenges just make so much sense. Our participants really shared so much important information.
Yeah.